Perfect. So appreciate everybody's time. This should take about a half hour, 40 minutes or so to kind of go through. I'll focus on kind of the Medicare and AEP focus kind of this webinar. You can quote final expense, HI, and dental separately of kind of the Medicare and AEP focused tools. So that's out there if you need it. But again, AEP is kind of here. And so I'll focus on kind of those pieces and tools. And this is a refresher for those that maybe have been in the tool and just want kind of an update on kind of maybe some new features that you hadn't seen before. Or if this is your first time in the Medicare Compare USA CSG tool, this is kind of a start and kind of understanding what's available and capable to you as the agent free of charge. And so this is the main dashboard or homepage that you get on the screen when you get logged into the tool. And from here, you see all the different tools and capabilities that you have access to. And we'll be focusing again on this Medicare stuff, kind of the Esoa and application stuff for this demo. We'll start with Medicare Advantage. And to run a Medicare Advantage quote, you just go under Medicare Advantage and click Run Quote. And I've preloaded a number of these screens here to allow you to kind of quickness of going through the tool. This is going to be the main demographics page that you'll see once you get into the Medicare Advantage tool. And all it's simply going to ask is a zip code, and that zip code will pull back to a corresponding county. This tool will run any county, state, zip code combination in the country. So it's not state or area specific. It'll quote every state and county and every plan. So there's no limitation. It's non-biased. We're not highlighting one carrier or area over another. You can also select your plan. We'll run Medicare Advantage, Part D, and the SNP plans, as well as the effective year. The new 2023 plans are out and live, and you can run previous years if you happen to want to look at a previous year or have a scenario where you still want to run a 2022 option. And lastly, two other selections. We have the monthly premium is what we'll default sort by. But if you wanted to sort by deductible or copay or any of those different types of options, you can. And if you wanted to adjust the pricing based upon a low-income subsidy, you can do that drop down to adjust the pricing available there. I can go ahead and run the quote simply with just this information and no drugs or pharmacies, or I can click yes to include drugs. So if I don't want to enter drugs, I can click no and run this quote, or if I want to enter drugs, I can click yes and begin to enter in those drugs and pharmacies. You'll also notice we have this application or applicant section here. This allows you to select clients out of your client manager, and I'll get to that piece here a little later on, but that allows you to save drugs, quotes, applications for those clients. And so if you already entered 9 drugs for a particular applicant and didn't again want to enter those 9 drugs again, you can simply select the applicant, and anything that you've entered here on the screen would be saved under that client. To enter a drug, you pick the fill method, either retail mail order or both. And to select a drug, you simply just click Add Prescription Drug. You begin to type in the drug. We'll do Lipitor as an example. It tries to guess which drug you're trying to enter. You select it. I can allow generics or substitutes if I so choose by clicking that box, yes or no. Dosages, packages if available, quantity and frequency. I can keep it open to keep adding drugs, or I can just simply add a single drug. As soon as you do that, the drug populates. I can then add the pharmacies. And when I click Add Pharmacies, it's going to populate a 10-mile, 20-mile, or 50-mile radius based upon the zip code that I entered on the quote search. And I can either use the map, or I can scroll down and select the pharmacy or pharmacies that I want. So you can select multiple if need be. Click Add to Pharmacies. And now I've got my quote results, my prescription, and my pharmacies all entered. After that, I press Get Quote, and it's going to load these plans in. I've sorted these by price, so it's cheapest to most expensive. Obviously, a number of these are zero premium policies. So it's going to be sorting them by max out of pocket. From this base level information here, it's going to give you if it's health and drug coverage or just health. Out of the drugs, are they covered? And out of the pharmacies selected, how many of the pharmacies are covered? So it's letting you know based upon this particular carrier or carriers, the drugs and the pharmacies that are covered based upon what you've selected. It's also going to give you star rankings and some base level company information like max out of pocket, drug premium, monthly premium, and so forth. You can see the star ratings are unavailable because I ran a 2023 plan and those don't come out until the 12th. So that'll be updated automatically on the 12th. If I ran a 2022 plan, you would be able to see the star rankings there. I can click show plan highlights, and this is really going to come by kind of a number of different things. Some high level company information like co-pays, co-insurances, Part B reduction, gap coverages, if they're in the insulin savings program, all of that information is here, as well as the drug tiers. Again, so just some high level information that most agents are interested in, as well as the county enrollment information. So if I want to know for this particular county, Douglas County, how by month, how many current Medicare eligibles there are, out of the eligibles, how many are enrolled, and then out of the enrolled, how many enrolled in this organization, and then how many enrolled in this exact plan. So it really gives you an indication of the size of the county, the opportunity of the county, and then how ingrained these companies are within that county specifically. And so not information that everybody's always interested in or every beneficiary would be interested in, but it's there in case you need it. From here, if you wanted to see the in-depth benefits of this carrier, you can click the company name or view plan details. They do the same thing. So when I click the company name, it's going to load in 4 different tabs for me. Overview is the same thing we went over on the previous quote. It's just a rendition of the exact same thing that was on the previous option. We have benefits and cost, and these are all the in-depth co-payments and co-insurances for every benefit that carrier offers, from hearing to foot care to emergency to ambulance to acupuncture to meal benefits. Everything that you would find, say, on a Medicare.gov site or an outline of coverage or EOB is going to be on this benefits and costs tab. We also have our drug coverage and costs. And so I ran a 2023 plan, and that information is available. Let me go back and run a 22 plan for you, and we'll be able to load this in. Drug stuff comes out with the star rankings on the 12th, and so I ran a 23 option. Okay, you can see here for the drugs, it'll give you the cost of all the drugs. So we have our selected drug and the tier it falls under. Drug costs for the pharmacies we selected in mail order, both the retail, before deductible, after deductible, in gap and after gap. And then the estimated drug costs for the rest of the year. What the monthly costs are, the cumulative costs, when you fall into the donut hole, and so forth. So this is your drug cost rundown based upon the drugs and pharmacies that you entered. And then carrier resources. This is going to be just if you need a member phone number or non-member phone number, you need to go out to their website. You need their address and so forth. This is what they have registered based upon that information. Also really unique with this tool is we have a number of agents that want to be able to fill in the gaps with the hospital indemnity plan, meaning where the Medicare Advantage plan falls short. They want to cross-sell a hospital indemnity plan in to fill in extra benefit. And to do that, you can click this print next to the print and save, and you can print any of this information or export it to PDF. Say you wanted to email this or share it with the beneficiary, not in a web version. You can click this print and save, and it just essentially saves that exact information, again, to a PDF or print it off. But next to that's the fill in the gaps. When I click fill in the gaps, it's going to carry over the zip code that I used, but also ask the age, the gender, and tobacco status. This is not important for a Medicare Advantage quote, but it is for a hospital indemnity plan. So after I make those selections, I can click search quotes. It's going to now find all the different hospital indemnity benefits or plans that are available in the state that I ran the quote for. It's now giving me all the different results needed for here. So we'll just select this Medico 7-day option. And we'll click add to comparison. I can add multiple HI plans if I want, but for demo purposes, just add one. You can see here on the left-hand side is all the MA benefits, and on the right-hand side is the HI benefits or the HI options. So I have a $350 per day option for days 1 through 5, and then 0 per day for days 60 through 90. Maybe I want to add in additional benefit of $200 per day to cover this gap of days 60 through 90. Of $200 a day, that adds $1,360 to my cost. Maybe I want to add in another lump sum benefit for a confinement of $500 per occurrence. That adds $11.20 to my cost, and on we go. So you get where the coverage falls short, the HI plan may be able to fill in those gaps and provide you as the agent a cross-selling opportunity. So they do not provide lump sum cancer benefits under this plan I selected. So you could add in a lump sum cancer benefit, $1,000 for first diagnosis for $192. So as I make my selections, it's going to begin to add up the total. So now I'm at $26.72 and $0 a month on the Humana Gold Plus plan. And I now have cross-sold or built my beneficiary 2 different options under the same tool. So it's a very unique use case and something that a lot of agents use when kind of in the field and dealing with MA, especially during AEP. So that's how to run a Medicare Advantage drug and quote options. We'll now switch over to Medicare Supplement, and to run that, you just go under Medicare Supplement and click Run Quote, and it's going to bring up a page that looks like this. Your client drop down is still here, so if you have demographics or different information that you've already entered for that client, didn't want to have to retype all that information in, you can select your client. Selecting the client is not required, and so you can just run a blank slate quote if need be. Beyond Medicare Advantage, where we just need the zip code to pull back the county, with Med Sup, we need age, gender, tobacco status, and plan, which all of you, I think you're probably available. We quote all the different options, all the different agents, genders, tobacco statuses, and so any of those selections you can see. We also have this Show Advanced button. It's not required to run the quote, and if you're dealing with somebody inside their GI or open enrollment period, this would not be needed. But if you're having somebody that say is switching plans or coming over from an MAPD and they want to now go into Med Sup for AAP and they're going to have to go through underwriting, you can click this Show Advanced button, and it's going to give you health conditions and medications. So you can enter different health conditions, say heart attack, and different medications that they may be taking and the occurrences and associated conditions. And it'll only show you carriers that would accept individuals based upon those health conditions or medications. Again, not required to run the quote, but it's kind of pre-filtering before enrollment to not only find the best company based upon price, but who actually would accept that individual in the event they had to go through underwritten options. And you get there by clicking the Show Advanced feature. After I've entered all this information, we'll now pull back the quotes, and here's the example of all the quotes. Again, we show 100% of the market. It's non-biased. We rank them cheapest to most expensive. So as you scroll down, the options will get more expensive. We provide your base level company information here, like the price per month, if there's a household discount and policy fee. If one or both of these don't apply, this section will be blank, meaning it won't be shown. That's not an error. They just don't have a policy fee or a household discount. And then some base company level information, like if it's an attained age or issue age policy, if there's an AM Best rating, if they have a rating class. You can see here, Prosperity offers both a standard and preferred rate, depending on if it's GI or open enrollment, and depending on underwriting, they may bump them to a standard rate versus preferred. So we'll label those rating classes there. Years in the market and the effective date of the rate that you're looking at, not the effective date of the quote. We also have a quote options tab here. This does 2 things. One is you can view the plan details. So here's all the benefits for that Med Sup option. And then we have a visit carrier resources, which just takes you to the carrier's page to log in and authenticate as the agent, to do an enrollment, to pull commissions, to pull a brochure, to contact the carrier, whatever you need to do through that carrier resources tab, direct with the company. We provide that link there. Beyond that, we have our quick quote section here. So if you wanted to change the plan, the age, the gender, you can do so on this page. You don't have to keep clicking back and forth. If you do want to start brand new, there's this new button up here in the top right-hand corner, and you can start back from the previous screen that we were on. On the left-hand side, here's our toolbar. We offer a few different options. The first is export, pretty self-explanatory. If you wanted to print this export option, you can do this print button. We have a red PDF export. If you want to dump this into a PDF Excel or a PDF sheet to email or save to your computer, you can. We have a green Excel feature if you wanted to dump this into an Excel database for those data-centric agents. That's also available as well. Below that, we have an adjust your view settings. You can do a number of different things from here. First is expand or contracted view. If you wanted to see a simpler view of the options, just the price and the company name, we allow that different view there. Or say you wanted to send this to a beneficiary, or a beneficiary was reviewing this with you on the computer. You didn't want to confuse them with some of the additional information. You can just show price and the company. Apply discounts. This is really going to apply the household discount to the rate, and the companies will readjust. So you can see there, Allstate Health Solutions, which is kind of a brand new carrier in the market. You can see that it adjusts accordingly based upon that household discount now being offered or entered into the carrier. Annual rate versus monthly, pretty self-explanatory. If you'd rather see the annual rate versus the monthly, you can. Fourth one down is market analytics, and this really covers three different things. We'll get to a carrier. These are a bunch of brand new carriers in the market, so they're not going to have much information to show. But for attained age policies, they'll show you each year the insured gets older, what they'll pay in future years. So they'll pay $114.98 today. But as soon as they turn 66, Allstate's going to raise their premium by 6%. If it's issue age or community rated, meaning its pricing does not adjust based upon the beneficiary's birth date, this will be blank. But for attained age policies, we'll show you each year the insured gets older, what they're paying in future years. We'll show you their filing increases. So when the company physically goes to the Department of Insurance, files new rates, we'll show you the date that they got those approved and the percent change either up or down. And that's plan, state, and company specific. So if I looked at a different company or a different state or a different plan, this very well could be different. And then market data. And this is NAIC data or financial data that's self-reported by the carriers. And they update this once a year. So you're looking at 2021 data, and at the end of 2022, they'll report all their financials for 22, and that updates every April. And that essentially is giving you total lives insured, earned premium, loss ratios, and market share, both on a state and national level. And again, this is not information that every beneficiary or agent is interested in, but we really view this as a market advisor tool, not just a quoting tool. And we want any question you would get from the beneficiary or anything you need to seek out for them, we want you to be able to do that right here on this platform. We also have select plans, not very popular. Most companies don't offer them, but if you are dealing with a beneficiary that wants to view select options, you can click the select plan button and the select options will show. Don't be concerned if you click that option and nothing shows up. Again, most states and a lot of carriers don't have these plans. And so it will be unique to see those show up, but they are there if available. And then underwriting filter, that's if I had done that filtering with the drugs and health conditions on the previous page. I wanted to toggle back and forth between the filtered and unfiltered view. That's available to do that there. So that's kind of MedSup quoting and how to run the quote. We also have enrollments. So you'll see for a number of carriers, we have this apply now, and we launch new carriers each month with the enrollment capabilities. And so each month you'll see more and more carriers have this apply now button. But when you click this apply now, what will happen is it'll ask you for your NPN or routing number with that carrier. We're validating you as the agent, making sure that that carrier is saying, yes, you're properly appointed and licensed to sell in this state and with us. Go ahead and let them through. If it doesn't, you'll be directed to go and get contracted with them before doing the enrollment. But when you click apply now, it's going to populate a screen that looks like this. And now I'm into the application for that carrier. It's going to give me my price per month carried over from the quote, my gender, my age, and my tobacco status that I used from the previous quote. So all that carries over. I have my different sections here on the right-hand side, and these are the same sections that you would find off of the exact application from that carrier, and it's the exact same questions. So nothing in terms of language or questions will vary from the paper application that they have to this. What will vary is regardless of which carrier you click on, this is going to look and feel the exact same way. So you don't have to learn 10 different processes. I know that applications direct with the carrier, everyone's different in how it looks and feels and can be confusing to agents. We've universalized this process, making the flow the exact same. You can do these sections in any order you want, and we provide green check boxes for sections that are done in good standing and yellow exclamation points for sections that are either missing information or, depending how you answer the app's going to be declined, and therefore it won't let you submit it. So it's kind of real-time feedback as you go through the enrollment process for the beneficiary to go ahead and do the enrollment. The beneficiary can sign this in person. You can print this to wet sign, or you can send them an email to DocuSign the app and submit directly into the carrier. When you do that, we'll go back to our home page here, you'll see an e-applications button. When you click on this, this is your repository for all the applications that you've started or submitted and their statuses. So you can see here, here's the company, here's the applicant and the status, whether it's incomplete, it's pending signature, it's submitted, it's approved, it's denied, it has an error, whatever that status may be that you need to communicate back to the beneficiary, you'll see those here. And you can always go back and edit or delete applications. Say you started one, you decided to delete it, you can remove it off of your repository here, or you started it, need to go back in and complete it, you can click edit and go back in. As soon as you click out of the screen, it saves the place that you're at. So you can fill out half the app, you need to leave and go to a meeting, come back and restart it. You can do so using this tool. So that's kind of MedSup, Medicare Advantage, quoting and enrollment functionality. Also important with AEP is Esoa document lockers. And so you can do an electronic ESOA on our platform by using this ESOA document signing. And I'll show you how to do that. When you click on this, it's going to pull up a compliant and approved ESOA platform. So to start a document, you would simply just click Start Document, and it's going to have you label the document. So we'll just do Medicare Compare USA Test ESOA. You can make that the beneficiary's name or whatever you would want to label it. Click Save and Continue. It is compliant and it is approved through CMS. And so because of that, they require this disclaimer for the agent to approve. So as the agent, you would just click I agree and continue. You can do this two ways. You can either do it in person. So if you're in the same physical location as your client, you can click yes and go ahead and do the signature right here on the screen with the applicant. Or you can say no, and I'm going to email the signature to the beneficiary. Say you're doing this over the phone, or you're going to go to a meeting with them and you wanted to send them the email signature prior to, you would just simply type in the applicant's email and click continue. It's going to confirm that it's currently awaiting the email signature. And we're done. It will send you as the agent an email once that's been signed. You can go back into this document signing tool to see any pending stuff that you have. So you can see all this. The status is awaiting signature. Or I can go into my document locker. After it's been signed, it will automatically save into my document locker, allowing me to compliantly save this in perpetuity. This gets backed up every night. So any materials or files that need to be saved can be done here. I can download this ESOA. It's going to have all my signed documents, the timestamp in case I ever need this. I get audited by CMS. It's all there. You can also save any other types of documents. You have a recording. You have different types of things that you want to save to your account. You can click this and upload any type of file you want. to save this and back up. Again, it gets backed up each night. So that's the ESOA tool. We also have, important for AEP this year, is Client Manager. And this is our CRM component to the tool. This is where all your agent information is saved. You can create one-off clients. So if you want to go ahead and create a client, just one-off, you can. You type in their information here and you press save. Or let's say you have a database of 500 beneficiaries or leads that you're trying to work or want to save them into the tool. You can click Import Clients, and you can drag and drop those files right here on the tool. It then populates those in Excel and automatically uploads for you, so you're not creating 500 different one-off clients. We also provide this training guides document, and in here, there's an example of a client import. So if you wanted to know how to format that Excel file to drag and drop it in, we provide that export example here by clicking that training guides document. From here, when you click on a beneficiary's information, here's where their drugs would be saved, their quote history if you did an application, all your different stuff that you would save under this client would be here. And then when you went and ran a quote for, say, Tim Jones, and you had drugs or you had their demographics all saved for that client, that's going to pre-populate in those quote results. You could also have all their different current products associated with what they currently have and the premiums that they pay in here. And that can be as a part of your client creation or import file upload. So that's kind of Medicare quoting, enrollment, drug, ESOA, and client manager stuff, the important stuff that you'd want for this AEP. I'll briefly touch on final expense and dental as the two tools that you also have available to you. Final expense is going to work a little bit different in that we're selecting face values. And so you can either type in or select a face value that you want to look at, or a monthly rate. Say your beneficiary can afford $50 a month. We'll pull back the corresponding options that are available for $50 a month and the corresponding face values for those. You can't run them both at the same time. That's why they're grayed out. Reason being is that this might not equal this and vice versa, and therefore no results will be returned. So we have you pick one or the other. We also have product type. So whether that's level, graded, return or premium, modified, different product types associated with final expense options. Works the same way as the Medicare stuff does, cheapest to most expensive. We price 100% of the market. Final expense, that's about 80-ish carriers across all the country, across the country.
Hey Brian.
Go ahead.
Real quick, and I hate to do this to you. I actually have to hop here. What I'd like to actually do is run this poll real fast. I just don't want to interrupt it, and then give the folks a second here to answer that, and then keep you moving if you want to. So if everybody could just take a quick minute to read those 4 questions and answer away for me, that would help me with some of my feedback I need to take back to the team. And Brian, I just wanted to say that, and from there I'll let you keep going. Thanks.
No problem, sir. Have a good one. So yeah, prices out cheapest, most expensive, price per month, company name, some base level company information. Your export features are still here. Your quick quote section is still here. A couple unique things with final expense. One is an apply fees. There's no household discounts with these, but if you want to go ahead and apply this annual fee to the rate, you click that apply fees. Obviously, the pricing adjusts accordingly. As well, the modals. We don't just provide monthly and annual with final expense. We know these semi-annual and quarterly rate options are popular. So if you wanted to see those options, you can based upon these selections. So that's final expense. We'll go ahead and switch over now to dental, which will be the last tool that we have not covered. again, works very similar to the rest of the product lines. We really want it the low barrier to entry. So if you can run a product on Medicare or final expense, you can run a quote on any of them. It's really a similar process, simpler view to all of our quotes. Dental and hospital indemnity work the exact same way. You don't have to do hospital indemnity with the fill in the gaps. You can run a standalone hospital indemnity plan, and it works the same way as dental. And these dental plans they're going to load in are going to be the base level options. So these are going to be no riders added, no tiers increasing. It's going to be the bare bones options that are available. So you can see here we have base level option, price, what the base plan includes. This is a vision plan, so it's a $25 deductible for an in-network eye exam. Go down to a dental plan here. So for this Mutual of Omaha plan, it's a $100 deductible for $1,000 calendar year maximum benefit. Your export options, your adjust your view if you only wanted to see vision plans, or you only wanted to see dental plans, or you wanted to see individual and spouse, children, or family pricing, you can include that in here. So you can adjust the view according to what you want to view on this. If you wanted to go into in-depth benefits about what these companies offer, you can go under quote options. You can see we have our visit carrier resources page here. So if you wanted to go to the carrier page, you can, or you can click view plan details just as we did on the other tools. But this is going to have some more in-depth benefit information. So if I had increased benefits, I can add those here. It's going to give me a breakdown of the exact benefits covered under this dental option. And if they have riders, I can add those benefits in. So that you can see here they have a vision rider. I can say include vision, and that's going to add $8.28 a month. And here's my vision benefit for that $8.28 a month. And if I scroll up to the top, it's summed it up for me, of which can be printed or exported to PDF. So pretty user-friendly, pretty self-explanatory in terms of what the tool can do, kind of the information that's provided. Some higher level information that I'll kind of go over before I'll provide my contact information after this call. So for those that want more information or want to talk about something that they saw that didn't make sense, I can go over it again. This is all updated in real time. So we get all the data direct from the carriers. There's nothing that you have to do to make sure that you're looking at. There's no software update that you need to do to make sure that you're looking at proper information. This is also all web-based. So you don't have to use it on a specific computer. You don't have to use it on a specific device. As long as you have internet connection, you can access this tool. It is also mobile friendly. So if you wanted to use your phone, your tablet, again, as long as you have internet, you can get access to the platform. If at any point in time you have trouble, you're getting an error message, something doesn't make sense, you can't get in, so forth, there's this contact support button here. And from here, you can submit a support ticket or provide our 800 number to contact us and get support right away. We also have this My Account button. Say you wanted to change your login information, change your password, change your contact information that would show up on any of the PDFs that you create. You can do that all under your My Account setting. You can also choose your defaults. So if you wanted to default to always have the household discount be on, or you want to default to only showing the condensed view of the results and not the full expanded view, you can adjust your settings using that My Account tab as well. Beyond that, if you don't have access to this tool, all you would need to do is go to insurancetoolsportal.com/MUSA. Here is your link to log in. You can see the Medicare Compare USA logo. There's a request account button. When you click that, you'll just enter some information about yourself, first and last name, phone, username, and then select your password, and then notes. If you want to add them, it's not required. That submits into Medicare Compare USA to approve. You're going to email once you're approved, and then you can log in, and you'll get this screen here once you get logged in. So that's how to get access to the tool. Beyond that, here is my contact information. If you want to contact me directly in regards to what we reviewed or went over on the tools, and this would be a good resource for you to kind of get prepped before AEP, or had questions and wanted to go over those again prior to AEP.